Well, many people think of having their wisdom teeth removed as almost a rite of passage, but a new policy by the American Public Health Association is now questioning the wisdom of pulling wisdom teeth, and it has sparked a controversial discussion among dentists and oral surgeons. When 36-year-old Marco Cease's dentist said he needed all 4 of his wisdom teeth removed, he sought a second opinion. After all, as a 7-time world champion kickboxer, he'd fought hard to protect every tooth.
I never heard a real reason why they needed to be taken out, just because they were the wisdom teeth.
After an examination, Dr. Joe Kravitz discovered only 1 tooth was infected and needed to be pulled. The other 3 were healthy.
My position is that it's safer for the patient to only have the treatment that is necessary.
Kravitz agrees with the new American Public Health Association policy stating wisdom teeth removal should be based on evidence of diagnosed pathology or demonstrable need, not just to prevent a future problem. In fact, the policy claims 2/3 of wisdom teeth extractions are not needed, subjecting patients to unnecessary costs and risk of permanent nerve injury.
Do you go around and remove all people's kidneys because they have a risk of kidney disease? Or do you go around and take out all people's wisdom teeth because they have a risk of getting tooth disease?
But oral surgeon Dr. Stephen Guttenberg says just because a patient isn't showing symptoms doesn't mean there isn't a problem.
Hard medical evidence has shown that, in fact, that patients who are asymptomatic very well could have disease, and the disease could be fairly widespread.
Guttenberg says not everyone needs their wisdom teeth pulled, but if leaving them in will lead to a problem later in life, it's better to remove them now than later.
It's easier. The patients recover more easily when they're younger. There's far less of an economic problem associated with them as well.
Now, both of our experts are stressing that a blanket policy for all patients is just not a good idea, and each patient should be evaluated closely to determine if removing 1, 2, 3, 4, or no wisdom teeth at all is the best decision.